Hi, Dr. Rob Pelletier, Chief Medical Officer at North Oaks Medical Center in Hammond, Louisiana. Giving you your coronavirus update. Hopefully you've seen some of my videos in the past which have given you a good bit of information about the COVID-19 virus that's out there, and we're going to give you some updates and give you some other information about things you should be expecting in the upcoming weeks. So first of all, a couple of updates. We are about 120,000 cases worldwide of the coronavirus. We continue to have countries added. I think we're up to 121 different countries. Certainly within the United States, if you've been watching the news at all, you know that we have not only cases throughout a majority of the states in the United States, but we have had some positive cases here in Louisiana over the past few days, which is certainly expected. We've seen this virus spread rather rapidly, and unfortunately, because sometimes in the way that this virus spreads, it's hard to keep track of all the people that have it and where they go. So what does that mean to you that we have cases here in Louisiana? How is it going to affect you today? And what our recommendations are? Really, they haven't changed. There's still the best way to combat this particular virus with the information that we know now is through a couple of common sense, everyday things that you do. What are those? Again, you've heard this a million times. Wash your hands and wash them correctly. There's a video on our North Oaks site. You can link it. It's probably listed right next to this video. It's about a 2.5 minute video that teaches you the proper way to wash your hands, not only how to do it from a scrubbing standpoint, but how to even turn off the water on your sink without recontaminating yourself. So it's a great video to watch. Certainly it will explain the proper way to do it. Again, like we said before, if you have access to hand gels, alcohol hand gels, and you're unable to wash your hands, that's a good alternative. Washing your hands is actually much better than just using an alcohol gel, if and only if you do it properly. Other measures that you can take. Certainly, the main thing that I would tell people is when they're sick, whether it's COVID-19 or it's a cold, or whether it's the flu or anything else, stay home. Stay away from other people if you can. Distance yourself by not attending large gatherings, keeping your children home from school if they are sick. All of those things make a difference in combating the spread of this virus, which, as we know, moves pretty rapidly. As we're making this video, today is March 11th. And just an hour or so ago, the World Health Organization did finally label this COVID-19 a pandemic. What does that mean? Should you be worried about it? It's a word. It lets us know pandemic means that it's spread worldwide and that it is out there. That's opposed to the word epidemic, which means there's a local outbreak. So, for example, you might have an epidemic of lice at a school where they may close it. That's what we talk about epidemic. When they've started to use the word pandemic, it just means that they've had widespread transmission of the disease to multiple countries in multiple settings. I think everybody already knew that. So now that the fact that they're labeling it doesn't change anything that you need to do or any of the measures taken, or you should have any more anxiety than you had yesterday. A term you've probably seen in the media if you've been watching any of the news or other editorials that have been out there is a term called social distancing. What is it and why do we do it? Social distancing is a term that epidemiologists use to describe things like the closure of schools or having students do distance learning through the internet, having people not gather at large events, maybe changing the way you are working, maybe working from home or working in a different manner through your computer from a distance away from other people. The reason that we do social distancing is to try to slow the spread of the disease. Obviously, if I'm not around other individuals that are sick, it's almost impossible for me to get it. It slows down and allows for the resources that are available to be available to those people that need it. So imagine it this way. If everybody in Tangipahoa Parish got sick all at the same time, the amount of people that we could see here at North Oaks would be difficult for us to see everybody that day. If we spread everybody coming over the course of a month or two, it changes the ability of our resources to meet the needs of the people in the parish. So all of those measures that are taken, and listen, if you've seen China and South Korea and the other places that are taking the measures, they're doing that to catch up with their resources. So what we will ask you to do is to keep abreast of what your local officials are telling you, your parish government, your state government, your federal government. Keep watching the news. They will inform you of changes. Obviously, your workplace will be doing that. There will be information that comes out from your parish officials about what they can do and what we would do here at North Oaks. You can certainly expect within the upcoming weeks some changes of how we see patients if we got a large amount of people in the area, of how we took care of patients here at North Oaks. We still need to be available for all of the needs of the people of our parish that don't have COVID-19, trauma, surgical cases, people with heart failure. All those patients still need to get taken care of. But we will have this new entity out there. So we want to try to make sure that everybody gets taken care of, but you may start seeing us doing video visits, handling things more over the telephone to try to keep people from getting too close to each other. Our waiting rooms are full of people that have multiple diseases. As you know, comorbidities, meaning other diseases that someone has, puts them at a higher risk for complications of the COVID virus. So we're trying to keep people that may be sick away from those people. Even in our hospital, our visitor policy may be changing over the next couple of weeks. We do that to try to make sure that the people that are in our hospital are protected from not only the disease that they're dealing with at the time, but from getting introduced to another disease from maybe somebody who's certainly a well-wishing relative or friend that wants to come in and visit them, but the last thing they need is to get another or have the addition of another illness. Through our updates, we're trying to answer some of your questions. Please, on our website, after you see this video, if you come up with questions, we do want them answered. Give us our feedback. We have multiple social media ways that you can do that. Our team will get those questions and we will try to answer the ones that are pertinent. One question that keeps coming up is about, should I run out and get supplies for my family? It's a really hard question to answer, but I'll answer it this way. I would tell everybody that lives in Louisiana to be prepared. You should already have an emergency kit at home. We live in an area where hurricanes and power outages are frequent because of our storms. So I hope everybody at their home has a kit with a radio and batteries and flashlights. Now this COVID issue is a little bit different in the fact that, as you've seen, people that are highly suspicious for having the COVID vaccine have been asked to stay at home, and that self-isolation is up to 14 days. So I would tell everybody it's probably prudent in any of your emergency kits to have enough food at home for a couple weeks. Now, I would also tell you that most people have lots of food in their house. Sometimes it's not the food that we're always excited about eating in the back of the cabinet, but you probably already have plenty of food in the eventuality that you were self-isolating. That being said, I would not encourage anybody to go out and buy 6 months worth of groceries or anything like that. Buy a modest amount of groceries that are non-perishable just to have on hand in case you needed to stay home for an extended period of time, but I certainly would not recommend that more than 2 weeks. Both of my boys are Boy Scouts, and that's their motto, be prepared. And I would tell anybody to always be prepared, but don't over prepare.